My name is Jim Biggins. I'm the president, founder, and CEO of a company called Access Vascular. Whoops. There we go. So at Access Vascular, we're in the beginning stages of actually commercializing our first product. We're focused on really addressing the biggest unmet needs and most costly complications associated with venous access. We're developing a proprietary biomaterial that's less recognized by the body and therefore doesn't enact the foreign body response, eliminating thrombosis, infection, and phlebitis, enabling the use of these devices without complications will really change the space and allow physicians to provide therapies without disruption. The crowd may be surprised to learn that 80 to 90% of all patients entering a hospital setting require some sort of venous access device. That's 400 million devices in the US alone. The uses of these devices is anything from the latest hangover cure to also implementing life-saving treatments such as chemotherapy and antibiotic treatments. Our materials have applications in all of these aspects. You also may be surprised to learn that despite the ubiquity within this space, these devices really suffer from a number of complications. It all starts with insertion of the device that triggers a foreign body response, namely thrombosis that leads to delayed therapies, also catheter occlusions, deep vein thrombosis, and pulmonary embolisms, which are all very extremely dangerous to patients. Catheter-acquired infections is also another dangerous implication of use of these devices. As we talk to users of the device, we found that they tend to complain a lot about insertion pain, discomfort, and otherwise swelling in the area of the device. All told, this is a $10 to $15 billion issue for today's US healthcare market. Current solutions are actually polyurethane materials almost exclusively. Over the years, manufacturers have attempted to utilize coatings and additives to cloak the body's response with little effect. Our device is completely novel. It's actually a completely new biomaterial that prevents thrombus accumulation because of the lack of foreign body response. It's also extremely lubricious because of the high water content, which makes insertion extremely easy. And over time, it actually softens immediately upon reaching body temperature, as well as becoming completely hydrated. Future versions of the device will elute antimicrobial drugs as sort of a secondary protection against infection. To date, we've gained commercial clearance on our HydroPick device. We've done extensive preclinical studies, including blood flow loop, where we've shown almost a complete elimination of thrombus as a problem on the device. Additional benchtop testing includes catheter occlusion tests, which we've shown 0% occlusion rate compared to 100% of our competitor. And that's translated very nicely into our 30-day animal studies in ovines, where we saw very similar results. The combination of all of these results gives us the confidence that we will be able to reduce cost and improve the outcomes for millions of patients and become the preferred venous access supplier within the space. Our goal as a company is to really provide transformational efficacy for these patients and these physicians that so desperately need it. We've now started to see the translation of these early clinical results, early preclinical results into clinical results, where we've seen a great amount of excitement from our clinical adopters, not only for the long-term clinical implications of the device, but also for the use in the ease of insertion, as well as the ability to use in difficult venous access cases. We believe we're creating the next 20 to 50 years of venous access technology because the material is so tunable. One example of that would be the chlorhexidine release, which we've shown release out for 60 to 90 days. We can also do this with a bunch of other therapeutic classes. We've recently closed a Series A round that will help us move with additional clinical and economic benefits analysis and also take advantage of some contracts that we've signed, primarily with GPO contracts with Premier, where we've seen an uptake and a strong interest in our technology with only being on the platform for a few weeks. We'll also round out our existing ability to utilize the technology in other areas. The team is of 20 people in Bedford, Massachusetts. It's led by Rohit, who's responsible for strategic marketing, Brian, who's operations and R&D and has done that for a number of medical device startups, and Katie Motherway, who's supported by a fractional CFO for finance, accounting, and administration. The internal group is supported by the board of directors and advisors, namely Brent Ratz, who's a successful medical device entrepreneur, JJ, who's a publicly traded CFO, and Greg Shears, key opinion leader at Mayo Clinic. We have 2 issued pieces of intellectual property for materials with a number of families currently being prosecuted, which will both provide enabling and blocking intellectual property. That's wrong back, whoops. To summarize, the team has successfully taken a number of products from concept through commercialization. It's a very, very large market, $4.5 billion market, and we have application in each one of those areas. It's protected by intellectual property, and we've seen the ability to hit milestones from the commercialization of our first product. We're seeking Series B investors as well as clinical partners. Thank you.